So we are, recording is in progress. So I'll have myself and Laura. Laura, why don't you start with introductions and we'll get going.
So my name is Laura Shaw. For any of you that don't know me, I do see some familiar faces. I have been here for about 6 years now. I'm in the counseling center. My Stockton title is Assistant Director of Counseling Services, which is now called CAPS, Counseling and Psychological Services. I'm very happy to be here today and working with Stacy. Even though Stacy and I talk on the phone periodically, we don't do presentations a lot. So when I received information about doing this with Stacy, I was quite excited. So in many regards, I prefer doing presentations in person only because I tend to be a walker and I'm moving my hands, but this is a wonderful alternate to that. The downside is Stacy and I did not pre-decide what we're doing and what slides, so we might be staring at each other or calling each other, which is fine. Yeah.
We're going to be awkward. It's fine. This is Zoom life, everybody. So I'm Stacy. I am my office name changed since maybe some of you have been gone. So as of a couple weeks ago, my office is now the Office of Student Conduct. So we manage our student conduct, our mediation, and our behavioral intervention. There is a new office called Stockton Cares that is going to be managing the early alert case management, leave of absence withdrawal process. And so I think that you'll be meeting them at the fall faculty conference. If this is the first time you are hearing this, welcome. If this is the second time and you're still confused, it's fine. We're going to go through it, but we're all under the umbrella of the Dean of Students. So we're all still friends, but we're just more specialized in the work that we do. So there's that.
And that is on one of the slides, so we could talk more about that. Yeah.
Yes. Yeah. So what we're going to cover today, we're going to talk about this, like I mentioned before, these are three populations of students that we frequently get questions about, or that we frequently find that there are questions, concerns, etc. And so we want to just give you the support to navigate them, whether it be in or out of the classroom. What services are available to support you as an employee here, working with these students, and then what your role is in assisting these students, and then you know, what's the best way to approach some of these situations if they're new or if they're unknown or if they seem challenging.
Me to take this on the next one. So obviously self-explanatory bit, I believe Stacy put it in the chat. The three populations that we're mostly going to be talking about today are the LGBTQIA community, pregnant and parenting students, and veterans and military. That does not mean that we can't touch on others. Those are just the ones that we're primarily going to focus on. Stacy, can you move to the next slide? Thank you. So remember a couple of seconds ago when I said we're going to talk about Stockton Cares. So this slide kind of encompasses the main support services on Stockton's campus. I'll go through each of them briefly. Stacy, feel free to jump in if I miss something. So the WGSC, which is technically called the Women's Gender and Sexuality Center, if you have not been on campus to go visit it, I very much recommend doing so. It is on lower F, it's F103. It has a beautiful lounge. There's 3 separate offices, one of which is Lori Dutton's, the director. Another one is going to be Teresa Barone's, and I believe she's starting in that position the second week in September. And the other office is not yet used for one particular person. I personally have used it over the summer to assist Lori while she did not have another assistant director. There's also a conference room there that can be privately accessed by a secondary door. So that's great for individuals that might need to do interviewing with the police department for victims of different situations that might need private access. Counseling and psychological services, obviously that is where I work. We do individual group counseling. We have walk-in services. So just so that each of you know, if and when you have a student that might be showing signs that they need to talk to someone, we are open Monday through Friday, 9 to 5. Certainly students can call or email to get an appointment, but they can also walk in. and they will be seen very likely that day if needed. If they are not in immediate need for an appointment, they might be given an appointment for the next day or two. Learning Access Center and counseling are in the same section of J-Wing, J204, same waiting area, separate offices. Learning Access Center is where students need to go if they need accommodations, both for academic reasons and or potentially medical reasons. Stockton Cares is one of the new departments here that I don't believe we still have gotten like an actual formal advertisement of this.
Yeah, the formal introduction should be coming shortly, but they are going to be doing our case management. So that's something that our office managed, like I said, leave of absence process, withdrawal process for the students working with registrar's office. And then they're also going to be managing the early alert process, which now the form itself has been changed to a care referral form as opposed to an early alert form. Not 100% of the case management services have carried over to the case management or Stockton Cares. So any of the Title IX related things are still staying between my office and the WGSC. Just as an FYI, I know that that might seem a little confusing, but don't worry, we know how to delineate things. So we try to make it as simple as possible, but it's always challenging at Stockton because I think we sometimes don't. And then, as I mentioned before, my office we're doing our student conduct, we're doing our mediation, so alternate dispute resolution, and then we're also still managing the behavioral intervention team. And so the behavioral intervention team, we manage students of concern, and so we review all of that from the last week and or the prior week since our last meeting, and try to respond and coordinate services for students as appropriately.
Do you want me to take the next one, Stacey?
Yeah.
So there is a question in the chat I didn't want to ignore, but I'm trying to also pay attention. So there is a question about talking about individuals on the autism spectrum. Certainly we can talk about that either in the midst of certain sections or at the end. We will have plenty of time to talk about any of that stuff. So I didn't want to ignore anyone. Health services. So health services, for any of you that don't know, is technically now called HOPE. Essentially, the services are the same. Most of those services are based out of West Quad, which is the brick building between Big Blue and main campus. Services that can be provided there are health education. So if you know Kristen Middleman, she does lots of education and presentations and events. Also, health services involves, what's it called? Gynecological services that are now off campus, but we have a contract with a local office that's off of Chris Scalp Road, if anyone's familiar with that. What else? Oh, the doctor's offices. So if any students are feeling physically ill, they can go to West Quad and be seen by a nurse, etc. For things like, earaches, flu-like symptoms, things like that. They do not have prescriptions on campus, but the doctors, nurses would give them a prescription that they can fill at one of the local pharmacies. Do you want to take the last two, Stacey?
Sure. So our assistance programs, we have three primary ones out of the student affairs. So we have a food assistance program. If you search food assistance on the website, it'll take, if you want to direct a student that is having some food insecurity, it'll direct them to a really simple form that they can fill out to register, and they can visit our food pantry and access all of, as much food as they need. We do have both grocery items, right, which is like canned, box, etc., as well as fresh items and frozen items. So it's personal toiletries and that kind of thing. So there's a variety of things that is available to the students. There's also the student relief fund, which students can access smaller sums of money, and that does not need to be paid back. And then there's the emergency loan program, which is maxed out at $500. That does need to be paid back. And then the last is the Military and Veteran Success Center. So some of you who have not been staff and working here all summer, or also how the announcement worked, a lot of the names of the offices in student affairs have changed. So if you're like, I thought that this was the Office of Military and Veterans services. It's the same office. We've done some refreshes. We have some name changes. It's totally fine. Same people. Actually, that's not true either. Jason Babin has moved on. He works to the University of Texas, I believe. And so we will be getting a new director, but they offer a lot of direct support for our military affiliated and veteran students.
I just want to add, thank you for saying that, Stacy. I myself work in conjunction with many of these offices very consistently, and I can tell you, I often am like, what the heck is the name of that office again? Just keep in mind that it's okay to be human and it's okay to not know the correct name. If you question any of this in the middle of the semester and you're not quite sure, email Stacy or I, and we're happy to help direct you to the correct office, even if we ourselves need to recheck the name. As I said, you know, the Stockton Cares Office and Office of Conduct has still not been formally addressed by administration. So I'm not surprised that we can't keep track because it's always changing. Some of the names seem like they're much more in line with where they should be. Other ones I'm still questioning kind of the reason behind. But anyway, the next slide here is, I work very closely with the LGBTQIA community. So if you ever have specific questions about them, again, I welcome you to email me. I check my email way too frequently, but for good reason. So I'm going to touch on some of these. I do have at the end of today, when we're doing questions, I would like to share my screen so I can show you where to find some of these on the website. Very easy. So some things to know, preferred name. Some of your students may use their legal name, have no issues, et cetera, et cetera. You may get a student on September 7th when you're calling roll or asking, you know, names that says, hey, by the way, my name is such and such on your list, but I'd prefer you to call me this. It might just be a nickname, but if in fact it's a name that they would like to be known as on campus, then you might want to direct them to the preferred name location on Stockton's website. And the reason I say that is because a preferred name change within Stockton's system will allow them to be known as that name on every class list. In most departments, the only things they will not be listed as are legal documents, such as things from financial aid, things that need to be their legal name, if that makes any sense. Again, I'm going to touch on this a bit later too. Pronouns. Some of our students prefer certain pronouns. Sometimes, I mean, I work with this population every day, all the time, and it's not uncommon for me to mess it up occasionally. What I've tried to do is, if a pronoun seems to be particularly challenging for me for a particular student, I really try to use the student's name when speaking instead of using a pronoun. It's like just this transitional thing that works for me. So in other words, if someone's name, if they had a dead name and now they use a different name that maybe doesn't visually connect for you, a good idea is to use the preferred name instead of attempting to use pronouns. It can just be confusing. All gender bathrooms. This is another thing I would like to share my screen later. You may or may not be aware that we have all gender bathrooms on our main campus and in Atlantic City. There's two beautiful maps that are on WGSC's website that you can click on. They're a little fuzzy when you see the initial one, but if you click them, they become very clear. Another thing to consider is if any of your students might be potentially having medical issues surrounding possibly gender transitioning or surgeries. Those are things to think about. Again, you do not have to be proficient in exactly what is required. You know, other offices will assist you with that. It's just something to think about if you have a student telling you, you know, I'm going to be having this certain surgery. Can I get support with that? Does that make sense? Hopefully that makes sense. Stacey, I think the next slide is for you.
And then I know, Christina, you had put a question in about working with students in your class that are having surgery. So as I kind of dropped in the chat, when we are issuing notices, we don't disclose what the surgery is for, but we will indicate that they are going to be having a surgery, any kind of recovery or timeout that they may have, and that, you know, we just ask you to work with them and be flexible where possible. Some of the students are really proactive in talking to their faculty ahead of time so that they can get a sense of, do I need to drop this class or not, or is this manageable with me also being able to do this surgery, because they often have a lot of physical limitations, you know, no driving, no lifting, like sometimes no walking. And so, you know, it makes it impossible for them to physically be here on campus because they can't be here, they can't, you know, sit for a class period. So we try to work with folks individually, but sometimes, like I said, the students are really proactive about that, and they can choose to disclose the reason for the surgery, but I will, as case managers, we will not, just for their privacy and whatnot. Okay, so working with pregnant and parenting students. So pregnant and parenting students are covered by Title IX. So it is often what I call the forgotten child, not to keep along with like the motherly kind of thing here, but of Title IX. So we often think about gender equity in athletics, sexual violence, sexual harassment. But what is included under that is the status of a pregnant and parenting individual. It can also include the non-birthing parent if the doctor deems it medically necessary for that partner to be participating in certain things. And so really under Title IX, it covers them from pregnancy, childbirth, recovery, nursing, and it also covers miscarriages. So as folks that we're issuing supportive measures under Title IX, so that's what the students are entitled to. And I want to make sure that we're clear. Pregnancy is not a disability, right? And so they don't go through learning access program for a reason. It's because it's not a disability. Being pregnant is just part of something that happens if you have the ability to become pregnant, right? I'm trying to not gender any of this. And so it's really important that we recognize that it's a temporary change in the things that they're able or not able to do, and it impacts everyone differently, right? So I have personally never been pregnant, right? Don't have any kids, only have cats. We've all met them, so on Zoom. And so, you know, each student's pregnancy is going to look different, and so the needs that they have will look different. They may choose to disclose to you that they are pregnant. They may not. They may tell you right before they're going to give birth. They may not. But what I encourage you is that as soon as a student does share with you that they are pregnant, is that you do refer them. Our office is still working with the Women's Gender and Sexuality Center to make sure that those supportive measures are issued and put in place. So what do those supportive measures look like? They look like excusing absences, right? And so that is something that's also mandated in Procedure 2030, which is the absence and attendance policy for classes. And so, you know, we are required by the federal government to excuse any absences related to their pregnancy status, again, as deemed by their doctor. And so we try to manage that and centralize it, so that way you're not having to worry like, what is going on? When do I need to excuse it? When do I not? We try to work with the students so that way they know to contact us. So we're a central location, and then we notify you so that you know that this request for an excuse, so they're going to be late, or you know, if they need to turn in an assignment late, that it is related to the pregnancy or their pregnancy and parenting status, and it's something that we've verified on our end. We typically will not disclose all of the information. Miscarriages are something that's really tricky to navigate because they are it can be a really painful experience for that student, and it can also be a longer process. And so sometimes when we think of a miscarriage, it's just something that, you know, you find out like that's something that has happened, but it can be a prolonged experience. And so the student is entitled to continual supportive measures throughout that experience. And we try to be really sensitive with how we share that information with the faculty. Sometimes we just say we're issuing a Title IX supportive measure and don't disclose why if the student is not comfortable with us sharing that. If they push, then we'll talk with the student, but it's it's very challenging. So if a student discloses to you that they have suffered a miscarriage or they've experienced a miscarriage, make sure that they're connected with the WGSC, but also perhaps they may need to talk to counseling, because it's a very challenging experience, and everyone responds to it differently. And so we want to make sure that our students feel supported. The thing with pregnant, they're my like special group. The thing with pregnant and parenting students is that they typically will have higher grades, higher GPAs than your average student, but they often do not persist. And so they have much lower graduation rates. And so there are things that we can do as a community to make sure that these folks are graduating. And that's part of why these Title IX protections exist. It's not to treat people differently, it's just to help balance things. Yes. Yes, so I see there are a couple questions. So yeah, the supportive measures can cover the partner as long as their doctor has said that it's medically necessary. So if it's necessary for them to drive them to doctor's appointments because maybe they're on bed rest, that would be something that we would send notices out for. Something like childbirth, if they need to help with like nursing and feeding the baby in those early timeframes, those are all things that we could cover. Some other examples could look like, if they're nursing or if they're having to pump, we can excuse them being late to class because of that. We have lactation rooms on campus and they are restricted access. So the student can request through the WGSC to gain access to it. And it has a refrigerator in it. It's got a chair. It's like, nice little comfy space for them. So we're fortunate to have that here on campus. So I see that there's, so the mental, I see the miscarriage thing. Yeah, it is. So it is challenging. Anytime I've dealt with it, I work with that student really closely one-on-one. And so I will increase my contacts with them and really just follow their lead and make sure that they know that there are other resources and connecting them with those resources. So sometimes the WGSC will just do a reach out, keep it nondescript and just say, we're here if you need anything. And just so that they can continue to support that student and just work through that with them, make sure that they're connected to their doctor, or if they have an external mental health professional that they're working with, if that person is keyed in. But we do make sure that we're keeping an eye on them, and because it is a very challenging experience, especially depending on what point in the semester it happens, right? So the last time that we had to manage this, it was in December, right? And so December is a really hard month for people just in general. It's it's around the holidays, which is upsetting for folks sometimes, but also it's the end of the semester. So we just try to work with folks as much as we can one-on-one to make sure that they are successfully completing their education. But there's lots of rules around it. If you have questions about the rules, I love reading about this stuff. I'm on a listserv about it. And so the Department of Education, which I could drop those links in, has a quick reference guide about the things that students are entitled to. There's also a full pamphlet from 2008 that the DOE issued. But in addition to that, a lot of the things that we are allowed to offer is dictated by case law. And so following that has really been my responsibility to make sure that we know what's going on and that we're following things. But what I want to impress upon you is that we just try, if it's in your nature, we try to be as caring as we can for them. Pregnant and parenting students face a lot of discrimination, even today, in the workplace, with their academics. And so, that's something that's really important to me, at least to make sure that we're balancing a little bit, because the impact that this person finishing their degree has is multiplied versus your average student. Anyway, I'll get off my soapbox and we'll move.
I just wanted to add, thank you so much. You're so knowledgeable, very helpful. As a mom who thankfully had children after I went through school, I think that's super helpful. One thing I did want to include in what you just said was, for our faculty and staff that are in this meeting, there's so many details, as you can hear from Stacy. There's multiple offices that can be of support. So as faculty and staff that might have a certain role with a student, please know that you don't have to be the expert. You don't have to know all of these things. Most importantly, just serving the role that you need to serve as either their professor and obviously being as supportive as possible, but also knowing how to connect them to the right people. That's the most important.
Yeah.
We're not expecting you to leave this presentation and know exactly what to do with every single thing, with every single situation. We're just giving you the information so you know it exists on campus. And if sometime in the next year, 2 years, semester, 3 semesters, you have some of these things happening, you will know where to go.
Yeah.
Thanks.
I totally, thank you, Laura, like totally co-sign that. Make sure you're just referring them to people, and that, you know, if we're issuing guidance or supportive measures, is that if you have questions about what this means, or what does this mean for my class? What is it, you know, what does this mean for if they're a student worker in your space? Please ask those questions, because I would love to help you navigate that and make sure that we're providing the best support for our students as possible. And I'm shifting with our military and veteran students. So there are really a few different things that will happen with them. The primary thing that has a bigger impact on their education is if they are deployed or if they're activated. And so one thing that I will note is, you know, there is the potential that we may see more students being activated this fall. I did chat with Ashley, who was over in the, you know, military and vets area, you know, with the current status of things internationally. There's a lot of fluid components to our students who are currently serving in the military, and so we may see some of our students having to go abroad. If you have a student that is notified that they have to be deployed or that they're being activated, you know, you will get a formal notice of that. There are two options, or there's two scenarios. Scenario A, if it's before the first 8 weeks of the semester, you know, the student doesn't have any protections regarding the New Jersey legislation. Those kick in 8 weeks and later into the semester. So the first 8 weeks, you know, really whatever is available to any other student is what is available to them. We are required to excuse their absences, but that might look like more they may have to drop the class. After those 8 weeks have passed, in the state of New Jersey, there is legislation that says we have options, right, that we can enact. And it is based on what the faculty member says. So the students may misinterpret this and say, I get to pick, but this is not choose your own adventure per the student. You can definitely work together collaboratively to choose the best option. But the options are, you know, they receive an incomplete and they complete the coursework when they return from duty. Keep in mind, some of these deployments could be up to a year, right? So we need to be mindful of some of that. So asking those questions would be helpful. They can receive the grade that they currently have in your class. And again, this is a choice that you're making, not that the student is making, but if you're comfortable with that they've consistently been earning X grade, you can assign them that grade. They can withdraw, even, you know, if it's outside the bounds of our dates for that. And then the last option is that they could do pass no credit. And so those are, again, this kicks in 8 weeks or later. We do in our procedure 2030, which is the absence and class attendance policy, does have notations in there about class attendance and excusing our military folks for deployments. Our students may have weekend drills. That is not something that we necessarily excuse. Those drills and weekend duties are known. Those are typically for our folks that are in the reserves, are known well in advance. And so they may make arrangements with you if they have assignments due over the weekend, but this part doesn't necessarily impact your classes as often. I know that there are some programs that are primarily on Saturdays, and so those would be where we would have to talk with the Military and Veterans Office to really learn more about how to navigate with that student. So managing our veteran and military affiliated students. So there's a couple things, right? Military and Veteran Services was temporarily housed in our office, and so we got to know some of those folks really well. I'm by no means an expert on any of this, but we will see, especially with our students who have been deployed or are coming back from deployments, is that a different person, right? Because the person that you were before you were deployment doesn't exist anymore, right? You've had a life experience that has changed you. And so readjusting back to civilian life can be challenging for them. And so it's important, especially if this is a student that you've had before, or that if you have some awareness that they are returning from a deployment or some kind of military exercise that has impacted them, is that trauma and PTSD manifests in many, many different ways, and that you're not necessarily going to see the same action or reaction from any of the students. One thing that you may see some aggressive behavior, you may see really sad behavior, you may see stoic behavior. There's a wide range of things you may see, but what we want you to remember is that we have counseling center here on campus. We have a counselor that is dedicated to working just with our military affiliated and our veteran students, Karen Matzinger. And so you're welcome to refer the students there. You're welcome to refer them to our Military and Veteran Success Center. And so that way those folks can really manage them. One thing that they wanted me to really highlight is to be thoughtful about when you call the police. And I know that there's been a lot of discussions in the last year or so about police involvement in de-escalating situations for a variety of reasons, right? But if there is a danger to the campus, okay, right, you're welcome to call the police. If it is a situation where there's not an immediate danger, I think one of the things they said is to be a little bit more thoughtful about involving the police, because it can, as you see with other situations, it can create an increased response from the student. So yes, danger to you, danger to the campus. Yes, thank you for that clarification, Jess. So if there's a danger, immediate threat or immediate danger, right? Call the police. We're not questioning that. But if, the student's being a little bit of like a jerk or something like that, and because sometimes when they know that people are affiliated with the military, there's this heightened response to them that maybe is unwarranted. So I'll give you an example. We had a student who was having some issues with PTSD and was having some strange responses, and the student was waiting to talk with someone in our office, and the fire alarm went off, and the student flipped out, like completely flipped out, and threw something like a piece of furniture that was in here, and it wasn't meant to be. No one was hurt, just to be clear, and nothing was broken. But the choice in that moment is, do I call the police, or do I try and help soothe the student and get them the help that they need? We chose the latter, instead of maybe interpreting that as like an aggressive stance that they were taking, because the sound was having a really strong reaction for them, and it was upsetting. So it's just something to be mindful of, I think, when we're really thinking about how and why do we use the police just in general, right? I think that we should also consider applying that with these folks as well. The one other thing they wanted me to highlight is that they can be really insular, and so our military students, especially if they've been deployed, can be a little bit reserved and cautious around crowds and people that they don't know. So don't take it personally. It's not you. It's something that they're just trying to manage, in their day-to-day life. So, okay. So just some ideas. We've gone over some of these things, but Laura, if you want to.
Sure. So, I think between myself and Stacy, we kind of touched on some of this already. I just want to reiterate probably for the third time, and I might have a fourth by the end of today. We do not expect any of you to be experts in any of these areas. Stacy and I do work with students in this capacity all day, all the time, and there's still things that I personally don't know. But just things to keep in mind. For faculty specifically with this one, when you're writing your syllabus, your syllabi, keep in mind some of the things that you can add to that, so that not that you don't have to then explain it in class, but it's a written document, so students can refer back to it. So some of the things we included today, you might want to include in that, including things like WGSC services, what to do if, you know, you have a medical situation, LAP, counseling, any of those things. If you don't know how to include them in your documentation, please feel free again to reach out to us. I definitely think that most of our websites are pretty up to date as of right now. So that could be a great way to just kind of add some content. Don't feel like you have to add everything. Most importantly, just some of the main offices that they might need to use. Flexibility, you know, obviously with COVID right now and the things that we've talked about in some other meetings that I've been in the last 2-3 days, I said to text to 2 of my dear friends that I work with, and I said, this semester coming up, I'm really grateful that I'm not an adjunct or a faculty member, because I can tell you that the counseling center is very nervous about what this semester is going to look like. But I respect each of you and I stand with you. I encourage you to ask us for support with students if you need it. We don't know what this semester is going to look like. I tend to be an optimist, but I'm also a realist. So we need to prepare for what we think it might look like and also support each other. So I'm really grateful to be here today. But I just ask that you be patient with yourselves and with the students, because that's all we can do. That's all we can do. As far as the other sections here, again, working together to support yourselves and the students. If you don't know, don't be afraid to ask. Again, we don't have to be experts in every area. We just need to know who to ask and how to get that information. Be open-minded and patient, as I said. Be discreet and mindful of certain situations. You know, we spoke in quite detail about miscarriages, gender issues. You know, many students are going to be perfectly honest with you and open, but not all. So we just want to be mindful that maybe that's a conversation to have privately, et cetera, et cetera. Again, if you're not sure how to approach something, just feel free to ask. Website, you know, again, most of our Stockton offices that we've talked about today have been updated, are wonderful resources. Like you can literally type in the search bar preferred name and it brings you exactly where you need to go for that particular thing. So I'm really grateful to be here, as I've said already 2 or 3 times. Stacy, feel free to add whatever you need to add to this.
Yeah, I think we covered some of the examples on here. So are there questions that you'll have? I'm going to stop the share and stop the recording if I could get all of my screens together.